discuss things regarding your heart health and prevention. I'm a cardiologist and I use this platform specifically for that to be able to discuss pressing questions that you may have about your heart. So when you guys are logging in, let me know where you guys are coming from and we'll do my best to answer your pressing questions. Why is it important? Heart disease is the leading cause of death in the United States of America. If you understand this, you can potentially prevent something bad from happening. And that something can be a heart attack, it can be heart failure, it can be a stroke, it can be kidney disease needing dialysis. It can be the significant amounts of expenses that you have to utilize in treating yourself. So the more we know, the better. The better we can control this, the better we can prevent drastic things from happening. So as you guys come in, let me know what your questions are regarding your heart and your health. Dr. Isang, cardiologist. And when it comes to heart disease, we have to look at the risk factors for it. So we have things like high blood pressure or hypertension, high cholesterol, diabetes, strong family history, smoking, genetics. These things all play a factor, and sometimes increases the risk of having heart disease exponentially. Meaning that if you have high blood pressure, yes, it can lead to heart disease. But if you have high blood pressure and diabetes, it probably increases your risk not twice as much, but maybe 2.5 times as much. So it's important that if you have some of these conditions, that they get treated appropriately, quickly, to prevent heart disease from happening. If you guys are coming in, let me know where you guys are coming from. Do my best to answer your questions. Welcome to the channel. This is Dr. Isang using this platform to discuss your heart and your health and the pressing questions that you may have. So when it comes to heart disease, we understand what the I caught it. We understand what the risk factors are. We have things like hypertension. So, what exactly is classified as hypertension, and how can we treat it appropriately? Addison Porter, I hope you're doing well. Hypertension or high blood pressure is when that top number is greater than 120. And there's different stages of it. You can have prehypertension when that top number is greater than 120 but less than 130. You can have stage 1 when it's greater than 130, stage 2 when it's greater than 140. And depending on the stages of hypertension, you can treat it differently. If someone has stage 1 hypertension or excuse me, if someone has prehypertension, then you can look at treating it without medications. We're talking about things with lifestyle changes, trying to lose at least 10% of your body weight, watching how much you were sleeping or how much you were not sleeping, being consistent with how much salt you were taking in, and just being aware of the stress that you have in your body, because those all play a huge component when it comes to your heart. Now, and if you have stage 1 hypertension where that top number is greater than 130 or that bottom number is greater than 90, and then you may want to look at the lifestyle changes and medications. And all these medications work well. You just have to choose the one that works well for you. So they all work well, but they also do have side effects, and these side effects can be very significant when it comes to heart disease. Some of them can cause leg swelling, ankle swelling, issues with potassium. So it's very important to understand this. I'm going to try to answer questions that you have regarding your heart. Can you make a heart for turkey? Jesus is king, bro. Let's go. Addison Porter, blood pressure 155/88 is considered high blood pressure. So you want to look at the lifestyle changes, but may also want to include medications to help bring that down. I do find that some people have high blood pressure due to something else, and that something else can be sleep apnea. It can be due to obesity. It can be due to issues with your thyroid, with your kidneys. So it's always important to also follow up with your medical provider to make sure that there isn't any underlying issues that's causing this high blood pressure. If you guys can hear me well, asking for two things. Number one, or three things. Number one, to hit a subscribe. Number two, to double tap. And number three, to just let me know if you can hear me clearly. All right, is it all right, Riri, Riri? Hope you're doing well. So it says currently taking medications. Blood pressure was taken 12 hours after medication was taken. I also do have sleep apnea and CPAP is being used. Perfect, perfect. So staying on top of it, 155 over 88. Want to try to drastically bring that down to about 140 and then 130 and then hopefully in the 120s. But sleep apnea is going to be a huge component of it. If you're overweight or obese, losing weight can also help with that too. But making sure that you're following up, which it sounds like you are, with your medical provider as much as you can. Welcome for the people coming in. Let me know where you guys are coming from in the States and any question that you may have regarding the heart, your health, or ways that you can prevent heart disease from happening. And you guys may be wondering, who are you that I should take advice from? So my name is Dr. Isang, and I'm a cardiologist, and it took me a long time to get to where I'm at right now. The stages that it takes to become a cardiologist is pretty extensive. You're looking at 4 years of undergrad after 4 years of high school, and then there's 4 years of medical school, 3 years of internal medicine training, and then subsequent 3 years of cardiology training. You can do more training afterwards if you should like, but I am currently working as a general non-invasive cardiologist, so I see a mix of everything. And if there's anyone that needs any extra help or extra procedures to be done, then I have colleagues who specialize in that. Addison Porter, do you have any questions regarding your blood pressure and anything else that you would like to know? So, like I was saying, while people are waiting, getting their questions ready, you have stage one hypertension, you have stage two hypertension. You can treat it with a lot of different medications, and then with the lifestyle changes, with the weight loss, treating underlying risk factors, and things like that. All of those help to treat with the blood pressure. Um, Other than blood pressure, one of the other things that we have to look at is, chest pain. People come to see me a lot of times for elevated blood pressure, and the other thing is issues with the heart rhythms, but also chest pain. So, when is chest pain concerning for a cardiologist, or when is it that someone's telling me, "Hey, I'm having chest pain. Should I go to the ER?" If you have chest pain here, pain that gets worse with exertion, or pain that gets better with rest, or a medication called nitroglycerin, then we really want to look at other things, um, such as cardiac occlusion of the vessels, or plaque buildup in those arteries that can be causing it. And how do we do it? We look at a history. How often is this chest pain happening? How what's the frequency? What does it feel like? Are there any triggers for it? Does it happen more in the morning, nighttime, after food? If there are enough, concerns for that, then we're looking at potentially taking you to the cardiac catheterization lab, or at least going to the ER to get more testings with an EKG, with a troponin level, and with some labs to help to paint the picture a little bit better. Do you consider a holistic approach in your care, such as traditional methods? You got to define what traditional methods are, but I use evidence-based methods predominantly. When I look at holistic care, I'm looking at, what foods can you eat that can be helpful in preventing heart disease, what foods should you avoid, what supplements are good for you, but Other than that, if someone is having a heart attack, I'm using traditional guideline directed medical therapies, things like aspirin, cholesterol medications, blood pressure medications, and heart catheterization to make sure that there's no blockage. So, after someone has had their cardiac workup, and if there's significant concern, we take them straight to the cardiac catheterization lab to look for potential blockage. Now, if someone has symptoms that are just not 100% concerning for heart disease, or is not the classic symptoms, then we can still do some other testings. And these testings can be something like an echocardiogram, which is an ultrasound of the heart, lets us know how well the heart's squeezing. If the heart's squeezing appropriately, then we have to uh, look at potential other causes. But if the heart is not squeezing appropriately, then we potentially going to have to look at the heart as being the cause of it. And this is doing a cardiac catheterization. Other things that we can do includes our stress test, treadmill stress test, or medication stress test. If that stress test is abnormal, once again, we're going to be doing a cardiac catheterization to make sure that it's not due to a blockage. Rush is in the building. What's going on? I hope you're doing well. Questions, and it's MV. If you have any questions regarding your heart, let me know in the comments, and I'll do my best to answer it. If not, it's gonna answer do some catch up and do some work that hospital work. And when it comes to heart disease, what gets us really concerned is that a lot of times people will come in and it's too late. They'll come in after they've completed having a heart attack, and you can try to open it up, but it won't lead to significant benefits, or basically we could have reversed the heart disease had we caught it early. So it's extremely important for us to understand what these symptoms are that people have, so that if someone is having it early on, we can treat it appropriately and potentially prevent a heart attack from happening. For those of you guys logging in, it's Dr. E saying, if you got any questions regarding your heart health or prevention, let me know in the comments, and I'll do my best to answer it. Right now, what I'm doing is just answering some questions that I've had and looking at some EKGs. Unfortunately, I cannot show it. Well, fortunately, I cannot show it because information on it that Welcome, welcome for the people coming in. It's Dr. V saying here, talking about your heart health and prevention. If you have any questions regarding it, leave it in the comments. We've talked about high blood pressure. We've talked about chest pain when chest pain gets concerning. The next topic is going to be about palpitations. But if you have any questions first, leave it in the comments. I'm going to do my best to answer it. Reza, what is going on? Doing well, doing well. Hope you're doing well also. Like I was saying, I use this platform to discuss your heart, your health, and ways that we can, understand our heart health a little bit better. The next thing I want to talk about is palpitations, and palpitations is that abnormal sensation that basically everybody feels. Anywhere from 4 to 10% of people feel it. Originally from Nigeria, living in Tennessee, but everyone feels palpitations. Some people feel it differently, and can be significant change of life for them. So you can have skip beats, and you can have pauses, you can have thumps, you can have flutters. Those are all signs of palpitations, and they can be nothing, but it can be something significant. So we can evaluate that with an EKG, and the EKG lets us know how your heart rhythm is doing now, and if there's anything abnormal that can be causing that to happen. If we don't find the cause of your palpitations with the EKG, then we can do a heart monitor. Those heart monitors can go any as little as 24 hours, but upwards to about 30 days. So they're really good in capturing it, especially if their symptoms are happening frequently. There's some people whose symptoms don't happen frequently. They happen maybe a few times a month or a few times every other month. So sometimes you may need longer monitoring, and there's different ways that you can do that. You can get something like an Apple Watch where you can monitor it frequently, cardio mobile, but there's a device called a loop recorder that is inserted under the skin, and it just monitors the heart rhythm continuously, and it can last anywhere upwards to about 2 to 3 years. Germany's in the building. I hope you're doing well. Thank you for taking the time to come out here. If you got any questions regarding your heart, just let me know, and I'll answer it in the comments. All right, more people are popping in. Just giving you guys a synopsis. This is Dr. Wait. Yeah. This is Dr. E saying using this platform to discuss your heart, your health, your prevention. Let me know where you guys are coming from. You got people from Germany. Nice to meet all of you guys. Now, we're just talking about what palpitations are, how we diagnose palpitations, and things to look out for. To skip beats can be very uncomfortable. We can use an EKG to rule it out, to rule out issues. We can do a heart monitor. We can do a loop recorder. But then there's some home monitors such as a Apple Watch, a Cardio Mobile that you can utilize to help with your palpitations, helping cover what's exactly is causing it. But a little bit what I'm doing now is just looking at EKGs. Let me see if I can show you guys what a typical EKG looks like. So this is a typical EKG, just reading them. There's quite a few of them, so it's pretty much what my next hour or so is going to be. So any questions you guys have about what I do as a cardiologist, things that I like, just let me know in the comments. But it took me about 14 years to become a cardiologist, and it's insane to think that much time someone is going to spend in school. But I spent 4 years of undergrad, 4 years of medical school, 3 years of internal medicine, and then 3 years of cardiology, equaling 14 years. One of my colleagues is doing 2 extra years, so he's going to be doing 16 years. Most of them are doing an extra year, but it's a beast. But if you know that this is your calling, it makes it worth it, because you'll be working your dreams. You'll be doing what you love to do for the rest of your life. I worked as a hospitalist and internal medicine physician for about 2 years, and I knew it wasn't my full goal, but it was a stepping stone to where I wanted to be. So super blessed to be able to be working and doing what I love to do. Welcome, welcome. If you guys have any questions, let me know in the comments. So I think after 14 years that it took me to get into medical school, the biggest question is, what was the hardest part? And I think hardest part, the first one is getting in. It's such a competitive process of becoming a doctor that getting in is going to be the first thing, and then the second one is affording it. Medical school is extremely expensive. I have over $400,000 in loans, and when you incorporate interest rates, I'll be paying back way over 400,000. So, understanding the finances that goes with it and how to utilize it appropriately. I'm on a really good payment plan. Been using this payment plan for over 10 years, but two of them didn't count, so I still have an additional 2 more years. So I'm in a 10-year repayment plan for my loans. Unfortunately, two of them didn't count, but uh, thankful that I'll be able to hopefully be done with it soon. So finances and struggles is an important part that doesn't get talked about enough. But we also have to look at things like the stress of medicine itself. We have to look at um, the the fact that if you practice medicine enough, you're gonna be responsible for someone passing away. You're gonna be responsible for something bad happening. And how do you handle that stress? How do you separate work from home? So there's a lot of things in medicine that can be very tough. Of course, certain specialties will be exposed to more of those things than others. You don't expect someone who practices pediatrics to experience death, but someone who practices critical care medicine may experience it on a routinely basis. Ray, Raleigh, I hope I'm pronouncing that correct. I hope you're doing well. Just free for all questions about your heart health, prevention, cardiology, becoming a doctor. Let me know. On the last few more EKGs, so I'm just gonna do a free for all talk. If you guys have any questions, let me know when it comes to your heart, to your health and prevention. But um, you know, what you do now is going to be the most important thing that you can ever do for the rest of your life when it comes to your health. So, what you do regarding your blood pressure, what you do regarding your cholesterol, what you do regarding your weight, especially, is going to dictate how you're going to live the rest of your life. Some people want to party and have fun and not take care of their health. Then they're going to have a lifetime of trying to catch up and make sure that they don't pass away from poor health. Versus if you look at what you're eating, not trying to be perfect but consistent, you can have a really, really long life. You can live a really, really long life as long as you don't have any, of course, underlying medical issues or congenital or genetic issues that can, make that not possible. But just stressing the importance of just understanding your health, understanding what you're putting into your body, understanding the impact of sleep, impact of stress. Like today was a long day, 12 to 14-hour day, and I still know that I have to go and put in at least 20 minutes of exercise just because I want to be able to live into my 80s and into my 90s. So really have to take control of those things and make sure that you're exercising because you want to now before you're forced to exercise because you need to. So But you can make it fun, you can make it, entertaining, or you can just keep it as boring as possible. But stay moving, be active, because the people who do the best, I've noticed, are the ones who are active throughout their life. My dad is a living example. Man goes on walks every single day, and I don't. Sometimes I question why he does it. Rain, just snow, sunshine. He's going on his daily walks, and he's not doing like 1 or 2 miles. He's doing 3 to 5 miles on a daily basis. Stay active, guys. I mean, like, if there's one thing that I can stress the importance of, it's just being as active as possible, because the people who are not are, are dying, and that's hard to say, but the less active you are, the more likely that something bad is going to happen. So stay active, watch your weight. If you have sleep apnea, get that treated. I can't stress that enough. But I'm gonna leave it for free for all. Trying to answer at least one question before I hop off of here. I've had some good ones in the beginning, but if you have any pressing questions regarding your heart health to prevention, let me know. What's going on? If you guys are just hopping in, this is Dr. Issa answering questions regarding your heart health and prevention. Let me know what questions you guys may have. I've kind of talked about a little bit of everything when it comes to your heart. Maybe it should go better here. Let's see. I've kind of talked about everything when it comes to your heart and your health. So if you guys have any questions, you let me know. Welcome to the ones joining in. It's Dr. Isang. Let me know where you're coming in from. It's Dr. Isang asking about answering questions regarding your heart and your health. Hey, let's go. Turn up. I know everything. I hope you're having a good day. I think the biggest thing that life teaches me as being a physician is just hug your close ones, hug your family members, because you just never know. So hug them tight, man. Is it Kiza or Keza? I think it's probably Keza. Kiza would be two E's. Okay, It came out finally. What came out finally? Looks like a paced rhythm. The truth about MNRI shots. What's the truth about MNRI shots? Dang, that's crazy. Cause many issues worldwide. MNRI shots. Hmm. Oh, mRNA shots. Went from mRNA to mRNA shots. Messenger RNA shots. What type of issues? Hmm. Yeah, it is crazy. Touchy subject for doctors to speak out. Nah, it's not a touchy subject. It's the truth. The mRNA shots were used for people who originally had. It's not were used are used for people who have cancer. So they work well. But yeah, I agree with you. They do have the side effects that are associated with it. Have I seen it? Yeah, I've seen people have issues with pericarditis or inflammation. Have I seen someone die from the COVID vaccine? No. Have I seen or heard someone say that they knew someone who's had really bad reactions? Yes. I've had 3 of the vaccines, and you know, I have the same skepticism about the future ones, but all I use is just more research and, kind of like you with the skepticism about, future research. I think it's how the research is put out, how the people are tested. In the past it was a pretty long process when it comes to testing, because you want to test to answer the question whether the medication works. That one is good. That's what we all want. But we also want to test to see if it's safe, because you don't want people to be having side effects. The heart issues are bad. I know people who have had terrible issues with it. Absolutely true. Um, but you can't deny that it didn't help people who. There are people who wish they would have had it. There are young people who had COVID that died, unfortunately, without any significant history. That's a tough one, because it's. Do I wish that there was a better way that this could have been utilized? Absolutely. But the honest truth is, I'm just not sure when the pandemic was happening what was going to be the best way to treat people. I don't think people, until you talk to a family that's lost everybody from COVID, That one is tough too. So it's tough on both sides. But man, shot never worked at all. That can be your opinion. JFK Jr. finally gonna take down FDA. Let's go. I like that opinion, and I just hope that the people that are in power help our help our country to become better. Vitamin D, vitamin C, eat healthy, and never get any shots. Let's go. Looks like a paced rhythm. Here's the truth about vitamin D. I think that's the one thing that is missed a lot. Undertreated vitamin D. I didn't realize until I had mine checked, and mine was extremely low. RBC count, mine fluctuates. I have sickle cell. It's a tough one. Looks like sinus with PACs. It's my patient. It's not good. Nah, man, you're a person who takes care of your body, and it speaks for it. So you got to be. That's a testament. Third degree AV block. Dr. Malone, Dr. McCulloch. Just looked up Dr. Malone, and the first thing that popped up was interesting. First thing that pops up is Robert Malone spreads falsehoods about vaccines. But yeah, I'll check him out because I think he has a pretty good research background. So I want to see it. Looks like COVID. All right, I'm on for about 10 more minutes. If anybody has any questions regarding their heart health or prevention, let me know. If not, you guys have a great weekend. Oof. Sinus tech. PACs mostly. Freaking fly in here. Not sure how I got in here, but YOLO. That is the dark. That is the dark part about medicine that I have suspicions about too. All I can do is talk about prevention, especially when it comes to the heart. Not everybody can have a heart transplant, but you can prevent your heart from becoming so bad that you need a transplant. Sinus rhythm. All right, just a brief overview of everything that we talked about. This is Dr. E saying, talking about heart health and prevention. Why? Because prevention is a lot better than treatment. So when it comes to heart disease, we have to look at things like high blood pressure, but also your weight, smoking, how much you exercise, how much you don't exercise. All of those play a factor into it. If you treat those risk factors, you decrease the risk of yourself developing heart disease or heart attack or stroke, kidney failure, needing to be on dialysis, the hyperlipidemia, your cholesterol, or the significant amounts of finances that you have to spend going to hospital visits and taking all these medications. Is one thing. So when it comes to hypertension, there's different stages. There's pre-hypertension, stage 1, stage 2. Pre-hypertension up to stage 1, you want to try your best. All of it you want to treat with lifestyle changes, but you also want to look at any underlying cardiac issues that can be underlying health issues that can be causing it. Things like issues with the thyroid, issues with magnesium, issues with potassium can also play a factor into it. And if you treat sleep apnea, if you treat those underlying issues, can potentially and significantly reduce that blood pressure a lot. So that's the one thing. Stage 2, when that number is greater than 150, you can still utilize uh, um, lifestyle changes, but sometimes people need to be on medications for it. The goal is to be on medications and come off of it with lifestyle changes. It doesn't always happen. I would say it rarely happens because some people don't change those lifestyle. They don't lose the weight. They don't watch their salt. They don't watch how much processed foods you're eating. They're don't watch their salt. Don't watch their salt. Don't watch their salt. That's probably one of the biggest things. Don't lose that weight. They're still morbidly obese. They're eating too much, and too frequently, which leads to insulin spikes, sugar spikes. Insulin is good to remove the sugars, but it can also lead to plaque buildup in the arteries, which can lead to blood pressure issues, can lead to issues with heart disease too, coronary disease, plaque, heart attacks. So that's the one thing that just want to stress the importance of when it comes to high blood pressure. And the next thing is going to be chest pain. Chest pain here, pain that gets worse whenever you exert yourself or exercise, pain that gets better with rest. When you have those symptoms, I'm concerned that you may be having heart disease. Go to the hospital as soon as possible. Check tests. If the tests are concerning, cardiac catheterization to look for blockage. If there's significant blockage, open it up with a stent. Some people may actually need open heart surgery. If there are no blockages, then we look for other potential causes: cardiac, non-cardiac, pancreas, gallbladder. Inflammation itself can cause that chest discomfort. But if all of those are negative, then we have to look at non-cardiac causes, or possibly even, anxiety or palpitation that can be causing it. Then the next one, palpitations, those skip beats, extra beats, pauses, can be due to excess caffeine, not enough sleep, sleep apnea. The foods that you're eating, certain foods can cause it, like chocolates. How we look it up is uh, um, doing an EKG first. It shows you what your heart rhythm is doing now. You can do a heart monitor anywhere from 24 to 40 hours. You can do a loop recorder that can go anywhere upwards to a couple of years. Palpitations is low magnesium, not for everybody. I have a lot of people who have perfect magnesium levels, perfect potassium levels. But you are correct. If someone has palpitations, you want to make sure that your electrolytes are appropriate, because that can cause it. I just had a patient that had palpitations for all their life. They didn't know that their thyroid was dysfunctional. So usually when someone is having issues with palpitations, check thyroid, check for other hormones. They may be perimenopausal, menopausal. Check for electrolytes, check for autoimmune conditions, check for the endocrine hormones, whether it's the adrenal glands. But also, if someone has a scar in their heart, that scar can lead to palpitations. So if you have enough risk factors with it too, some people may actually have palpitations secondary to a heart attack. So it's always important to follow up with primary medical provider to make sure that you don't need to be seen by a cardiologist. This is Dr. E saying, using this platform to discuss your heart health and prevention.